A warm welcome to all from SGT University. I am Dr. Vijay Bhalla from SGT College of Pharmacy. So, dear friends, today we will be learning about pharmacy practice regulations in India. Who a pharmacist is? Pharmacist is an IST, intellectual social trendsetter. A pharmacist is a qualified healthcare professional. Why this topic? Pharmacists have been neglected healthcare workforce in our country. Reports, maps, tables on health providers often exclusively focus on doctors and nurses. Pharmacists tend to run under other associates, auxiliary allied support staff. Pharmacists, the apostrophe of the health profession, as conveyed by Professor B. Suresh, President, Pharmacy Council of India. So, what is it required to become a practicing pharmacist? The pharmacy practice, by its definition, covers is the discipline of pharmacy which involves developing the professional roles and of pharmacists. Most pharmacists wants to be pharmacists, not doctors. So who is a pharmacy practitioner? A community pharmacist, hospital pharmacist, clinical pharmacist in corporate hospitals, and drug information pharmacist who is a specialist. Let's look at the USA, United States of America. To become a practicing pharmacist, one must have doctors of pharmacy, that is PharmD degree. PharmD program requires at least 2 years of undergraduate study and 4 academic years of graduate pharmacy. PharmD program is accredited by Accreditation Council of Pharmacy Education. After passing PharmD, one has to pass the North American Pharmacist Licensure Examination, which is also called NAPLEX. NAPLEX is a 185 questions exam administered by National Association of Board of Pharmacy, NABP. It assesses a pharmacist's ability to provide safe, effective, accurate, and competent pharmacotherapy. Each US state has a board of pharmacy. In addition to passing the NAPLEX and obtaining a PharmD degree, pharmacists must also apply for licensure to practice in a specific state of United States of America. Now let's look at the United Kingdom. To become pharmacist in the United Kingdom, one must have 4 years degree, 1 year pre-registration training, or 5 years integrated practice program. Overseas Pharmacist Assessment Program, OSPAP, 1 year course for admission in 1 year pre-registration training. 52 weeks of pre-registration training approved by the Journal Pharmaceutical Council, GPHC, of European economic countries. University must have accreditation from GPHC. Registration assessment exam conducted by Royal Pharmaceutical Society of Great Britain, which is also known as RPS. Let's look at the European countries. In European countries, pharmacy degree program are of 5 to 6 years duration. The degree awarded is M.Pharm or Master of Science. The M.Pharm program fulfills all the criteria required under European regulation concerning equivalence qualification. European Union citizen achieving an M.Pharm degree is eligible to apply for registration in any of the European member state. M.Pharm degree should be GPHC accredited, which was there in United Kingdom. In addition to the registration with regulatory authority in the member state, GPHC maintains register of all the pharmacists of European Union. Let's look at the Canada. To become a pharmacist in Canada, one needs a bachelor or doctor of pharmacy, again a PharmD degree. To pass national board examination conducted by Pharmacy Examining Board of Canada, PEBC, practical experience through an apprenticeship or internship program is mandatory. License of practice pharmacy is issued by provincial regulatory authorities. So look at, to become pharmacist in Australia, one need a bachelor or master pharmacy MS degree. After completion of pharmacy degree, one need to register with Pharmacy Board of Australia and complete internship of approximately 1 year with registered pharmacists. So look, most of the countries has mandatory 1 year internship. Now let's look at India. To become a pharmacist, one need either diploma, a bachelor or doctor of pharmacy degree from an institution approved by Pharmacy Council of India. However, the diploma in pharmacy is a bare minimum qualification to become a registered pharmacist. Register with State Pharmacy Council of the state in which he wants to practice. As I told you, 15 January 2015, a pharmacy practice regulation was introduced in India. So let's see the gaps. In Western countries, European countries, minimum qualification is post-graduation in pharmacy or practice of pharmacy. In some countries, the minimum qualification for practice of pharmacy is graduation plus internship, mandatory internship. Beside qualification, registering authority also assess their capability and assessment. But in India, the minimum qualification for practice of pharmacy is diploma in pharmacy. So major gap lies there only. So we lack practical exposure in India. So prior to framing pharmacy practice regulation in 2015, pharmacist responsibilities were not defined except for dispensing and or compounding of medicines. Pharmacy practice regulation 2015 have prescribed detailed responsibilities, and major responsibilities are, of course, dispensing, compounding and supply of the drugs, appropriate information on drugs dispensed or supplied, research and health promotion is added. Pharmacist shall involve himself in activities like preparation of formularies, both at hospital level and state national level, critical assessment of the promotional material prepared by the drug companies, preparation and dissemination of patient informational leaflets, prescription handling, prescription assembly, assessment, safety, quality, efficacy, rational confidentiality, correct information, documentation, legality, duration, age weight compatibility, misuse potential, compliance to label, etc., including expiry check and delivery of the prescribed items. Pharmacist shall also involve himself in activities like patient counseling. This has been included and which is very useful. Special direction, common side effect, self-monitoring techniques, storage, refill information, misdose information and recording. Even prescription auditing, prescription and medication error monitoring, maintenance and review of digital records of the drugs administered to the patient, process and outcome research, that is analytical studies. Pharmacists undergo a minimum of 2 refresher course of minimum of 1 day duration within a span of 5 years for renewal of registration, updating the knowledge of drugs through continuing education program, training to the pharmacy student, that is apprenticeship, promotion of rational and responsible use of medicine, enforcement of drug laws, ethical practices and ethical dispensing. Pharmaceutical care, monitoring overdose, underdose, interaction and duplication of the drugs, even public health rules, protection of health personnel against communicable diseases. So let's look at the top 5 pharmacy jobs in USA. Of course, community hospital and clinical pharmacists are heading towards the topmost jobs. Then even these days, a specialized pharmacists are picked up in long-term care pharmacists, chemotherapy pharmacists, poison control pharmacists, consulting pharmacists, ambulatory care, regulatory and home care pharmacists. So the role of pharmacist in United States of America is really picking up. Now let's look the condition of India. We have 130 crore population right now. Let's assume that if one patient or one person in our country at least visit his physician 3 times in a year. So we have approximately 390 crores of the prescription floating in Indian market. And now see the role. Patients spend just 5 minutes with the physician because he just diagnose and write the prescription. But 15 to 20 minutes are spent with pharmacist on understanding and doses regimen, administration of the dosing. So this is the role of pharmacist becomes utmost important with patient in India. Let's look at some job opportunity in India, which are now coming up, a new type of jobs for a pharmacist, clinical pharmacist, a PharmD graduate. Beside academics, they can go for mass and media communication, pharmacy practices, pharmacovigilance, data analyst and market research analyst. Health technologies are gaining these days a lot of importance because medical gadgets are very important, like you can monitor your BP and heart rates. Medical coding is also becoming an important segment for clinical pharmacists, and of course creative pharmacists and clinical research pharmacists are picking up. So some of the suggestions in pharmacy practice regulation: diploma in pharmacy course is still being run with 1991 regulation. The type responsibility prescribed in pharmacy practice rule cannot be fulfilled with old syllabus. BPharm syllabus cannot meet the industrial need. Students do not have exposure to new technologies. Institutions do not have modern equipment. If some have, students are not allowed to handle. So to bridge the gap, my suggestions will be: diploma in pharmacy course may be abolished. Minimum qualification for practicing pharmacy should be graduation in pharmacy with an exit exam, including internship program. BPharm syllabus may be reviewed and expert from industry may be involved. There should be 2 papers on forensic pharmacy or pharmaceutical jurisprudence to understand the drug laws in detail. Either there should be a specialization of BPharm level, that is a pharmacy practice, industrial pharmacy. Alternatively, there should be a 6 months internship for pharmacy practice and 6 months internship for industrial pharmacy. Though pharmacy school and practice school has been included in BPharm curriculum. Industry, there are specialized jobs. There should be postgraduate diploma courses in manufacturing technology, quality control, quality assurance. And there should be a training program for newly introduced topics like quality by design, QRM, PQS, both for industrial and regulatory staff. So let's look at the India. Again, a pharmacist never gives up. The third largest healthcare professional in the world. So in India, their role is expanded from dispensing to pharmaceutical care by maximizing the benefit of medication and their safety. The counseling to the patient is one of the key roles that pharmacists offer due to the higher trust level and time spent. Public regards pharmacists as the first choice to seek medical counsel for minor ailments. Pharmacists can make a unique contribution to the outcome of drug therapy to their patients, quality of life, and to public health. Pharmacists working in community pharmacies, hospital setups, clinical setups, working in medical analysis laboratory, and pharmacists engaged in research facilities are all involved in executing their responsibilities with utmost sincerity and dedication. So after doing a good pharmacy program, one must be able to understand and answer drug overuse, underuse, substance abuse, drug interaction with food, alcohol, and drug-drug interaction, nutraceutical as a foodstuff as medicines, and interventions for elderly, physically challenged, mentally challenged, and even drug addicts patient. So these types of role and responsibility should grow. Let's know the facts about patient education. 50% of the patient walk out of the physician office not knowing what they were told or they are supposed to do with the medicine. This is a research finding. So here comes the role of pharmacist, because physician normally does the part of prescription only. So pharmacy practice regulation in India has been introduced. Now it is our time to gain more and more access to the knowledge, practical exposure, so that we can be a confident pharmacist and a practicing pharmacist. Thank you very much. I hope you have enjoyed the topic. In our next lecture, we will study about the Drugs and Cosmetic Act and Rules 1945. See you till then. Keep growing, keep learning. See you next time. Thank you.